to call to order our Incarceration Prevention and Reduction Task Force, and you are here at the Behavioral Health Subcommittee. Today is May 17th, and it's just a few minutes after 9. We've got a full agenda today. I'll go ahead and get us started. My name is Mike Parker, and I'm the co-chair of this committee along with Dan Hamill. Before we begin, though, I'm going to go ahead and read our land acknowledgement statement. We acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us here together today. And please join us in uncovering such truths at any and all public events. All right. Again, thank you all for being here. Jill, thanks for shrinking the agenda down. As y'all can see, we don't have a packet today, but we do have some presenters. So without further ado, we're honored today to have Representative Alicia Rule with us today. And I'm going to turn it over to my colleague, Dan, who actually reached out to Rep Rule. Dan, was there anything else that you wanted to lead off with or give us some context on?
No, Representative Rule and I had a great conversation a couple of weeks ago, probably for about an hour or so, and was just really impressed with the work that's being done and the vision and direction that Representative Rule is taking us in terms of behavioral health. And she's a champion. She does it professionally as well. So I just wanted to give her an opportunity. I invited her to come and talk with us today. So Representative Rule, this is the Behavioral Health Committee, as we discussed, of the Incarceration Prevention and Reduction Task Force. And our charge is to look into all things that are related to behavioral health issues as they relate to the criminal justice system in Whatcom County. And so, yeah, I just wanted to give you some time here today to discuss some of the things that you've been working on and your vision moving forward. So thank you for joining us today.
Well, thank you so much for having me. Yes, I will start off by saying, sorry, we're doing a car meeting. I apologize. I got stuck behind a train. The good news is we're fixing that intersection, so the train will no longer be an issue as soon as that gets done. But in any case, I'm happy to be here with you today. I've been working really hard on the legislative side. I think on many things that you are aiming to do as well. And so us connecting here today is really just a privilege for me because my goal is to realize your vision. So looking forward to many talks from here, but I can give you an update of where we're at now, and maybe you'll help me know where we want to go from here. This last session was a really big, well, actually, the whole time I've been in the legislature for 2 years has been, we've just made really great strides in the behavioral health space across the board. In fact, it's kind of to a level where it's a lot to talk about. So if I miss something, I hope you'll let me know that you have a question about that, because we've really impacted in a lot of spaces. One of the things that we worked on early on that I'm sure you're very familiar with is the Crisis Stabilization Center. And I'm just thrilled that it's up and running. One of the requests that came to me was to build that out a little bit more. So the first year in the legislature, I had a goal of getting the operational expenses for that Crisis Stabilization Center put together, and we did that. So then, the second year, we found a couple of things that needed to be tweaked on it, and one of them was transportation. So that transportation is now funded in this second year. We have about, I think it's 2.25 or $2.5 million coming toward this Crisis Stabilization Center, and there's I apologize, Maplewood Behavioral Health Center, which is 32 beds of inpatient units that will be housed and located on the same property near the Crisis Stabilization Center that you're familiar with. So making the linkage and really building out a system that can care for our chronically mentally ill and our really complex behavioral health folks at whatever level they need. So maybe somebody comes into the Crisis Behavioral Response Center and they after the 72 hours, they're not ready to go back home, or maybe they don't have home and they have complex behavioral health needs. We are now going to have a fully funded building that has the treatment that they need right there. And I'm really excited about that. And I hope you are too. This is kind of monumental, and we're leading the state in this area. In addition to that, in another location, we've got a detox center that's going to be housed in Lummi Nation. And that also is going to be so helpful, and they'll be able to work together for our community members who have these behavioral health and specifically substance use disorder needs. And then lastly, the tie that binds this together, and I say lastly for now really is what I am more thinking about this, because we know in the background of all of this, we have the 988 system as well. And we're one of just a handful of states who has funded a 988 system and put it into statute. So that is coming down the line. And all of these pieces that we're doing in Whatcom County will fit toward the goal of using that 988 system to support our law enforcement, to be able to do law enforcement while behavioral health professionals can work with folks to get them the help they need in more of a case management component. So we have the enhanced behavioral health unit at Maplewood, 32 beds. We have a detox center on Lummi. We have a crisis stabilization center. We now have added transportation. We've tweaked the law just a little bit, and we did that this last session in order to make it easier to make those transports and to get people in real crisis the help that they need in those centers. And we brought that, instead of having, as you know, I think, we don't know each other that well, but forgive me for being repetitive, we're really moving toward community behavioral health. And that means that people can get help when and where they need it. We know, I'm a social worker. I know that it's most important that we keep folks in community, because when they have gotten the treatment they needed and we help them to make a plan, which will then link with, places like the Way Station or some of our other community housing that we're building, we can, if they need that, and some don't, but many do, we can then help folks make a plan that works for them in their own community, and they'll be statistically much more effective and responsive to these treatments if they're in their own community with connections with people that they know and places that they know. So really all of this together is building out a system that works and using data and information that isn't based on bias, but based on what we know is effective treatment for people. And it also is a variety of levels, because mental health is just, it's a spectrum, and more like, even I think about it like a spoke, that at one point in a person's life, they might need a certain level. At a different thing, maybe a crisis happens, or, some sort of economic change happens, they might need a different level, and then it goes back again. So it's our responsibility and my goal and my hope that we continue building out a system that works really well when and where people need it. And I think that you all are working on that too, and share that goal. Lastly, the alternative response system. We are going to be the leaders there as well. We have been for a long time, but the alternative response team now has full funding for what they need, at least for now, which is $2.5 million, to be the leaders in Washington State, really building out those Grace and Lead programs, so that we can have people out on the ground working with people right where they're at, and help them then fit into whatever services are going to be best and most effective for them at that time, in that place, for that particular individual. So this is a lot. It's kind of a mouthful, but it's a mouthful because it's a comprehensive plan, not finished, but a fairly comprehensive plan for truly addressing behavioral health needs in our community in a way that works, in a way that provides dignity, and in a way that is effective using the science that we have. At this point, that's kind of my basic overview, but I am very happy to answer any questions that you have.
All right. Thank you so much for that overview. And it is a mouthful. My brain is going and processing, and it's exciting. And we know too that a lot of the things, for example, a new behavioral health unit or Maplewood Treatment Center, those take years to build, but that doesn't mean that it's not a reason to celebrate now. So I will do my best to see hands. And currently I am seeing Brian Estes. I'd like to call on you first, please.
Yeah, thank you, Alicia, for taking the time to talk with us. I just had a few questions, I guess, related to the implementation of 988 and some of the gaps that still exist in our crisis response system, mainly the crisis response is not really 24/7, and there's some issues with transport and other things. And I'm sure you're familiar with this HB 1477, this initial assessment of behavioral health crisis response and suicide prevention services in Washington. I mean, I know some of the members of that committee went down to Arizona and Georgia, which have very robust statewide crisis response systems in place. How do you see the next couple of years in terms of funding to bolster? My understanding is this year it's 988, next year it's a mobile response, and the year after that it's more treatment facilities in terms of funding priorities from the legislature. Could you talk about that in terms of how we kind of fill in some of the gaps that still exist in crisis response in Whatcom County?
Yes, thank you. That was a robust question. I'll do my best. Going back just a little bit, some of the transportation concerns that you mentioned, we actually did address this year. And that is in that $2.5 million that is allocated for the alternative response team, specifically in Whatcom County. So many of the things that you asked about, we're heading right in to do. And we are doing it in Whatcom County so that the rest of the state, when 988 is on board, learns from our mistakes and sees what worked well. And the reason we got that funding to do so is because we've already been ahead of the rest of the state in this area. We just didn't have the funding to really build it out in the way that it would be most effective. I had the privilege of sitting on a mental health, basically it was a mental health fellowship, a national fellowship last summer, and sat in every meeting that was a national meeting, amongst legislators that had to do with the 988 system. And many of these questions don't have the specific answers yet. So we're only, I think 4 or 5 states have this. So this is really new. And when we do really new things, we don't have all the answers before we build it out. That's the downside. The upside is we'll be the first on board to have this. Yes, that group of legislators that I do work really closely with did go down to Arizona. I know they were looking at a lot of the actual facilities, and the description that I heard from Representative Orwell is that, it's like more like walking into a Starbucks when you have a mental health crisis. And the feeling when you walk into these centers is one of being taken care of and nurtured, not one of being punished. And so I think, that's an important feeling to give to people when they reach out for help, because we know how hard it is to be able to make that first step. And we know it's really important for it to be immediate and appropriate. And that's really not happening in our community right now. But I'm sure you all know that because I'm speaking to colleagues here. Tell me more about the rest of your question. I think I might have lost some of the detail, Brian.
I'm just wondering about, a lot of this comes down to funding, funding for case managers, for additional, therapists, and then the facilities. And I know University of Washington, they're building that new center in the Northgate area, and some of the innovations they're coming up with over the next several years can help. But how do you see the funding stream from Olympia helping us fill in some of the gaps?
Well, that's literally my job, is to go and secure that funding for our local community. So you can count on me to do that. I've been doing that. That is not a neutral thing. I can honestly tell you, I don't think I really realized how much of it is that, but there are good legislators and there are legislators who sit around and show up. And I worked really hard. So that I will continue to do that, and it matters. And so when you have something that you know is going to be good like this, and we're leading the state, and I do the work the way that I've been doing, we're going to be able to secure that kind of funding when we need it. However, I did want to say, we also, part of the work is not just to get money from state taxes. Part of the work is also to secure and align with our federal delegation, which I do regularly. And the other thing is working with private funding like the Balmer Group, which is also very helpful in this. So it's a complex way of funding and treating appropriately a complex problem. And I think that's what we really need to be doing, because none of this is simple, easy with a one answer. It's really getting the experts in the nation in the room and thinking hard about what we're going to do about these very challenging issues ahead of us, and how can we do it well, not to just do it, but to do it well in a way that really impacts people's lives. You know, the individuals who I just passed on my way into the office, many who are on our streets, their lives, because they're somebody's daughter and son and brother and sister, but also the community around them, my employees, myself, my children. It's in this community, this is one of the biggest things we can do to improve quality of life for everybody. So it's worth putting the time in, it's worth fighting for the money. And that just takes good strategy, good relationships, and I'm up for that challenge.
Right, Brian, thank you for that question. And Rep. Rule, thank you for your answer. I believe next up is Stephen Gockley, followed by Dan Hamill.
Representative Rule, thank you so much. It's really heartening to have someone with your professional background, your thoroughness, and your work ethic tackling so many of these issues that we're dealing with. One of the things you didn't mention, and I think because you keep a finger on the pulse of our conversations here in this group, you're aware, threads through almost everything we talk about, are workforce bottlenecks and a pipeline of workers for the out years. So much of what you've described will be dependent on having adequate, capable professionals handling those tasks. I didn't hear you speak about that. I'm interested in what, if any, conversations are going on in the legislature, or your own thoughts from that seat on how we can make improvements there over the next couple of years.
Thank you for asking, because it crossed my mind when Brian was answering his question and I forgot. This is the number one challenge. It really is more challenging than getting the funding, actually. Funding's always a challenge, but I'm less worried about that. I'm number one worried about this. We have to figure out what we're going to do about our workforce. It is not an easy problem to tackle. I have been directly involved in the work around this. And when I came in, first off, I don't think I really appreciated the gravity of the situation. And then we had a pandemic. And so we already had a shortage. We already knew that we had a burnout problem with these professionals. We already knew that they were underpaid. And now we understand. And for me as a social worker, this is the dream come true. For many years, we just always worked under the impression nobody would ever notice us. We would quietly get the work done. We would be underpaid. And, you know, we would be out there working in dangerous conditions without the tools that we need. That's just kind of our norm. When people, and also the general public not having any idea what we do. When people began to realize, oh, these folks are highly trained and they are very impactful, this is the dream, because we've been wanting to do this work forever. We love that. But the real problem is we don't have the staff to be able to expand our usage of these professionals I feel weird about saying usage, but expand the roles of these professionals, myself included. We don't have the people to do this work yet. So we have got to do some very targeted work that will not happen overnight. Some of it is happening at that UW facility that Brian Estes talked about. I'm really happy about that. It's a good start. But I think we also have a dire, urgent need to sit down, and I tried to get this done in the last 2 years, and we weren't able to get there, to sit down and take a hard look at the hours that are required post-licensure. But it's really tricky because if we reduce those hours, we can expand the workforce, but we do need to make sure that we keep quality, because the trouble in this work is if you know a little bit, you can actually go out and do damage. So we need to make sure that there's a structure in place to keep the people that are doing the work safe, doing safe work, and having good boundaries with good professional clinical supervision, but not making it so hard that people just burn out and go, this isn't worth it. I'm not getting paid anything for this. I'm going in these dangerous situations. I'm going to go work at Starbucks. It's an ongoing issue. It's probably number one priority. I think we're going to see some movement in this next session, and I plan to go in fighting hard like a boxer on this one, because we've got to deal with this. But I think also the other thing we need to do is work. I've already been working with Representative Slatter, who's done a lot of apprenticeships in other professions. We need to look at what other professions are doing and see, can we borrow some of these things? Washington State has higher number of required hours than most, especially in social work, than most other states across the nation. There's no database that tells us that it actually does the work, that it does improve the work. Intuitively, though, we do know there's something to it. And so you'll get your professional organizations like NASW, your National Association of Social Workers, your clinical psychologists, and your mental health counselors. They're going to say, whoa, we're not doing this. We need to be able to keep standards high. So there is the tension. It's there's a work group that we were able to put together, and we put a lot of pressure on those groups to figure out a solution for this next session so that we can make some movement on that. The other thing we did was we raised Medicaid rates, reimbursement rates. And when we do that, the market shifts. It hasn't happened yet. So we're in a really bad spot of, wages have not gone up for particularly government workers, but really the mental health sector in general, they will probably about July-ish, we should see that impact, but the cost of living is skyrocketed. So we have lost people because of that. I could go on and on. Okay, so the other thing I just have to say is we lost a lot of women in the workforce, a ton during the COVID pandemic. So at some point during that part where everybody was out of the workforce, we had, no women there. Like it was like lower than the number of women in the workforce in the 80s. And then all those folks had to come back to work at some point, and we didn't get them back. It's still challenging to, for example, be a parent, and in this era, even though we're quote unquote back to work, schools have appropriate things going on so that if your kid gets a sniffle, you got to go pick up your kid. It is difficult to be a working parent right now, and the whole sector of kind of like those professionals who are mid-stride in their career, I think that we've lost a lot of them, and secondary trauma. So I regularly talk to clinicians who have been in this field for 30 years, and they're just done. They just can't keep going. They've been living this vicarious trauma right alongside their clients, and it's very difficult to sustain them. So we have our work cut out for us, but I'm up for it.
If I could just add a quick follow-up comment. It's one thing to expand the number of providers. It's another thing to channel them into the sort of high risk, high need, really intense work that we're talking about doing with the client population we deal with. So I'm hoping that your conversations with fellow legislatures see that as a piece of the puzzle as well. And I think that ties in with the burnout, the dropping out of the career, and all of that as well.
Yeah, I mean, here's the thing. I've had many therapists say, I can't afford to live here. This is great. I love my work, but I can't afford to live here. So if we cannot figure out a way to hit the levers in order to get those wages up, we're just going to lose them. We're not going to have them, particularly in our community here where the housing costs are really high. So we need to look at that, because if we're losing them to even other states, that's a problem for us. And we have to look at the impact. I love and supported and worked on telehealth. And I know that was an important piece that we need to hold on to, because it offered access to a lot of people who weren't getting help before. But it also means that we have to look very carefully at our laws, and not only writing the laws, but implementing and holding accountable people who are breaking those laws to, for example, work in California while they live here. And so then they're treating outpatient people or kids in California because they're getting paid more and living here, and we've lost our workforce. So it's a complicated puzzle.
Rep. Rule, I do want to get to Councilmember Hamill's question. I wondered if I could just do a brief follow-up. On this committee, and we partner extremely well with our law enforcement folks. And I see we have Chief Tanksley from Blaine, obviously, and Under Sheriff Doug Chadwick here. One of the things that we're aware of, in addition to behavioral health workforce challenges, is we have our criminal justice, our law enforcement challenges. Has that been part of your conversation? Then I'd like to go to Councilmember Hamill's question after that.
Yes, it is. It's exactly the same. We need to do both. And the other thing we have to continually think about is when we're sending out these behavioral health professionals, they need law enforcement backup. They can't go out there into these things by themselves, and put themselves in precarious situations. And worker safety is really important to me. Nobody should have to go to work. And I realize that both of these things are risky professions, particularly law enforcement, but they need to be able to work together in order to be able to keep everybody safe. Because sometimes when you're walking in, I know, because I've done it. I've done it with law enforcement. I've done it without law enforcement, and it's not always a clear line. But there are plenty of times that as a social worker, I've walked into scenarios that are clearly not safe, and I needed law enforcement with me. But it's a partnership, the way that I see it, and we need more of both. And I think some of those processes, and there's workforce shortages everywhere, but as a legislature, what are we going to prioritize our work on? And I think both of those have to be at the tip top, because public safety is really one of our biggest challenges right now.
Thank you for that response. Councilmember Hamble, and then Chief Tanksley.
Thank you. So, Rep. Rule, I want to get back to Maplewood and just some particulars around siting, and will it be the what build? Is it going to be in a current building there, or is it a new build? How does that part of it work?
It is a new building, but really the details of that will fall into the hands of the county. So we secured the funding. They gave us a proposal that tells us what it's going to do. How they do that will be up to the county. So I would suggest specifically speaking with those folks.
Okay. And the reason I ask is because that Division Street property is a potential site for a new jail facility. It's a candidate site. I don't know if it will end up being there, but we're trying to figure out, what can go there next to the Crisis Stabilization Center. And do you envision the ART being housed at that location or somewhere else, or is that also a county thing?
County thing.
Okay.
Yep.
Okay. Thank you.
Mm-hmm.
Chief Tanksley.
Sure. Rep. Rule, if you could just talk a little bit more about the co-response model with the law enforcement officers and the behavioral professionals, I would say those challenges that you talked about, although we are specifically the Sheriff's Department is the leading agency right now that's going to have that model. What do you think are the greatest risks? And is there a certain time of day, time of night, or how do you, as a professional, how do you suggest that we make that the safest that we can going forward?
Mm-hmm. That's a great question. And I love that you gave me the professional input here, but I kind of also look to you all because although it's I'm not out there doing the work. So I'm happy to support, happy to fund, but you know, you tell me, give me your feedback and let me know, and let's do a pilot that fits our community well. I am aware of the options, you know, nationally, there's really only a handful of models that are generally happening right now. And we have to decide what's going to be our best fit, but we are not stuck in that. So if we decide down the line, we want to change and move, you know, move to the cahoots model, or we want to move into one of these others are doing, we can do that. But as it is right now, we have started with Grace and Lead, and it's going to require partnership. There's just, you know, that's going to require leadership and partnership between law enforcement and behavioral health, and working together that comes internally and locally.
So would you agree that for law enforcement agencies to do this, that we need more funding specifically with those type of units?
In addition to the $2.5 million that was just allocated? Is that the question? For this next pilot? No, I would not agree with that. This next pilot has $2.5 million allocated, and I'm very hopeful that that will work. If it does not, then let's talk.
Thank you.
Thank you.
All right. Did we have any other questions? And Rep. Roll, you have been so gracious as we pepper you with lots of questions, but we want to be respectful of your time. So I wanted to check and see if we had anybody else that had questions. I'm not seeing any. Is there anything that you would like to leave us with?
Yeah, my real thing that I'd like to leave you with is call me. If you need something that's not there, call me, which I know Chief Tank always does. But I would invite anybody on this call to do that. That's how, none of this is, it's not written up in a multiple choice. We make this happen. So if something is missing, or you have an idea that you think we should do, let's put it on the table, because now's the time to have these discussions. And we're going to figure out what works and what doesn't work. And some things are going to work better than others. But we're doing monumental work, and we're going to do a whole lot better than we're doing right now by working together. So please, you know, consider an open invite. I will always pick up the phone. My door is always open. I'm happy to meet with any of you. Bring me ideas. Let's work together at every level of government, bringing in private funding, and see what we can do for folks.
Great. Thank you. Jill, did you have something? I see your hand up.
Yes, if the chairs want to allow attendees to speak, I have one attendee hand raised.
That would be fine. Rep. Roll, do you have another minute?
Sure.
Okay, wonderful. And who is attending here?
Kim Sauter, go ahead and speak.
Hi, I'm Kim Sauter. I'm with the NAMI Whatcom also. I'm the executive director, and I've met you before, Alicia. Thank you so much for all your work on behalf of those that are affected by mental health conditions. I just had a question, you know, has the Maplewood facility with 32 beds, are they going to take people involuntarily? Because, you know, just with the conversations we've had with law enforcement, with all the family members we see at NAMI Whatcom coming to our program, so many of those folks have loved ones on the street, people that are severely affected by mental health conditions. Maybe they have substance use disorder. They are not going to go voluntarily. They are the kind of people that the GRACE program would have to work with for a very long time. And these people are getting sick before the age of 24. And I know the IMD exclusion prevents Medicaid from reimbursing, you know, for facilities, but for some people, they may need longer periods of care, you know, rather than what's happening right now. That's kind of my general question. Thank you so much. I appreciate it. Yeah.
I appreciate that question, because it gives me the opportunity to say what I know everybody on this call knows. This is not the end all be all. It is not going to solve every problem that we have. It is a consistent commitment to building out more and more treatment and more refined approaches to a monumental problem that we're facing. we're not going to fix this all in 2 years because this problem didn't happen in 2 years. I can talk in great length about a lot of other problems that I see as well. I think that there's work to be done on the Involuntary Treatment Act, but this session, when I tried to hit on that, I didn't have enough votes to be able to move on that at all. But I asked the question, and the way this stuff works is like when you ask the question and you start pushing on things and you start figuring out who's who, then you build those relationships so you can change hearts and minds. And we will have this next session a different group of legislators. So I expect that we'll be able to do a little bit more in this next session than I was able to get done this last session, particularly on some of that stuff. The other thing that I think we'll be looking at is the question of what's going to happen with this, the Blake decision, right? The decision about, is it going to be continue to be illegal or legal to have simple possession? And when it says simple possession, that's what the law says. It's never simple. So all of these things are related, right? Like they're all related to each other. And when we press on one thing, it may impact the other. There are no quick fixes, but we need to keep moving through the work. The other, you made me think about two other things as well. Much of this can be prevented. So I hate when I hear, folks are hitting the streets before age 24. I think you said 24, 25, because it's like, okay, well, let's back up a little bit. What could we have done, or what can we do for those folks in the earlier years to do better prevention? Because that's really sad to me to think that we've got loved ones on the streets already in those early ages. So that looks like making sure that we have access to behavioral health, outpatient services. That is not happening right now. We have wait lists. I don't want to take too much of your time, but I have a lot to say about this. So just stop me if I'm going too far. But, access to mental health for children is absurd right now. And then particularly if you, like 50% of the people in our community have Medicaid, it's especially abhorrent. There have been plenty of times in the last couple of years where our behavioral health centers that we have in town are so full, they're not even taking a wait list. So how does that feel when you have a family with a child or a youth that is at risk, and likely even at risk for running away, which turns into homelessness, which turns into all these other things that we know are interconnected. But that parent, what tools do they have? The WISE program is full. So we've got to support and build those preventative programs. I am really happy that we were able to get more mental health professionals in every school across the state. I'm proud of that work. It's not everything because we're going to have to staff that, but it's certainly one way to be able to help people get connected in with services on this spectrum. The other thing is we need more inpatient behavioral health space for children. That might be uncomfortable for people, but sometimes we need to keep people safe. And we've got kids in Children's Hospital in Seattle, that so many kids that are suicidal right now, that the non-mental health portion of the emergency room is full. It's spilling over because we have so many kids who are at risk to harming themselves or others, that they're taking up the space and there's not room for everybody. So we have long-term work to continue to build out all these pieces, both with budget and the legal piece. Like I said, that one piece I'm kind of looking at to try to see if we can make some movement on getting folks the help when they're not ready. But I think we have an obligation to do that work, because whether it's our neighbor or, our daughter or friend, these are real people and they need help. And it is not okay to let them lingering out using drugs on the street in front of my kids or your kids. And it's not okay if they're, out there because I'm afraid they're going to die. We've got fentanyl out there running rampant. So we have a lot of work to do, and it's not going to be any simple fixes. There's not going to be one budget item or one thing that will fix all the problems, but we continue to build this comprehensive system out. And I think that's the best way we can support our law enforcement too. When I first met in, I think it was 2019, with some law enforcement folks that would really like some support, I said, what can I do if I end up in the state legislature? What can I do? And they said, we need more mental health support. And I said, well, that's great, because I'm a mental health professional. you know, I'm already going to do that. What else can I do? What's your number two? And they said, there is no number two. This is our number one. Please help us, because we are here to do this work. We love our community. We're out working with people every day. But when we have somebody who's going to jump out of a, you know, 3rd story window, and she literally showed me that, we need somebody who has the skills and the training to know what to do, because if the guy jumps, what am I going to do? You know, like that's the kind of skill and training that comes from a partner in the behavioral health space. So we just keep working on building all these pieces out. Oh my
Thank
gosh,
you.
one more thing I have to tell you.
Oh.
Developmental disabilities. So this is another part that we are missing right now. And we did a lot of work in this last session, but we knew that we had an uptick in some of these developmental disabilities happening in our kids. But we have to remember, whatever's happening with our kids, they grow into adults. So we've got to be able to have a system in place for some of these newer autism has not, you know, it's not new, but some of these developmental disabilities have gone up in their incidences so much that we have to be able to be responsive and preventative, because these kids are getting older and they're growing up and into adults. And then we're seeing that the overlap between DD and mental health and substance abuse is kind of a trifecta, and we're not responding as well as we have an obligation to do.
Yes.
Thank you so much for that answer to that question. Rep Rule, if you have time for one more, I've got Perry Maurer, who also has a question. The longer you stay
I'm
with
here
us,
all
we'll
day. I
probably
just
think
worry
of more.
about boring
Are you
all.
game for more? Okay, Perry, I'd like to call on you, please. Thank you.
Thank you. Thank you, Representative Rule. And actually, I was responding to Ms. Sauter's question to share with folks that relative to involuntary, although obviously those needs are there, as you had described and so forth, that Representative Rule was involved in proviso funds for our Crisis Stabilization Center and establishment of involuntary temporary holds there. And that is the 12-hour law enforcement holds. And so we've made a significant step in that regard. There was a requirement, as you are well aware, that the provider had to become certified specifically for this particular hold, and they have accomplished that step at this point and are in the process now of also ensuring that they have the workforce, you know, necessary to actually implement that process. So we'll be able to move forward with that, and it's key to the proviso dollars that you had provided. So it was a ways back in the conversation, but I just wanted to say thank you, you know, in that regard, and that we are utilizing those resources and moving forward.
Thank you.
All right, did we have any other questions? I just want to make one last comment. As I was listening to you, one, I get a little inspired because I can clearly see your passion, and we appreciate, respect, and we need that. This group, you're right, would be good to stay in contact, because we regularly hear a lot about problems, but we don't always hear about solutions or action. And one of the things that I just want to reflect back to you, as you were talking about the youth mental health, I remember community health improvement plans from like 2015, 16, 17, 18, 19, telling us that youth mental health was was scored the highest by a lot of providers, right? That we had a lot of issues. Housing was an issue. All these things were issues. Youth mental health and the basic services, enough quantity of it, the right types of it, being able to have the full spectrum. You mentioned, you know, involuntary treatment, not only having children's, right, where your child has to leave the community to get a higher level of care. Well, not only have those things persisted, they got worse. And as you mentioned, now many of those things have wait lists. You know, our federally qualified health centers, they can't hire therapists. There's like 4 and 5, you know, positions going unfilled. So I know that you know it, and we just want to lift that up, that behavioral health workforce really touches our efficacy in so many areas. And whether that be the youth mental health population, whether that be ride-along folks to go with our deputies in the far areas of Whatcom County, we need it all. And it's so whatever we can do to support or be your data source or to give you testimony that you can take to Olympia. But that is one of the key things, I think. It seems to be the linchpin. If I had to pick one thing out, I might say workforce. How can we make it desirable for people to live, to work here, and to work in this area?
I agree with you. I think that's going to be one of the biggest levers to be able to get to this next time.
Yep. All right.
And it won't be overnight. That thing is, we need it overnight, but it won't be. The other thing is we got to work with our state universities so that we can ensure that those spots are filled, because that is something that has been historically a challenge so there are things that we can do around that as well. We do have a program that is in the social work program that helps build, because we have the same problem in the child protective services and child welfare space. So we did build a program that specifically will help pay folks student loans if they agree to go down that road. I think there are lots of things we can do there as well.
Well, thank you. We don't want to keep you any longer. We want to just thank you so much for your time today, and for all the information. And we look forward to checking back in again in the future.
Thank you so much. I appreciate being here. I hope to hear from any or all of you. Take care.
Thanks again. All right, Jill, would you mind putting up our agenda one more time? Okay, so I see next up we have, that was a really good conversation, by my head swimming. So if I seem a little bit, I'm just trying to, I wanted to take mental notes, but I know, Jill, thank you in advance for taking notes. We'll get good notes so we can follow up. Bellingham Downtown Security. And I'm wondering, Jill, if we have seen our next round of presenters.
We do. Darby Gilligan is available for this presentation.
Wonderful. Darby, thank you so much for joining us. Dan, I wanted to just offer very quickly, since you were the inviter here about this, if you wanted to just give a little bit of context for folks, and welcome, Darby.
Sure. So there's some things afoot happening downtown. Our ambassador program is up and running. The private security has been up and running for a little bit here. And in a conversation with Stephen Gockley, we both felt it would be important for the city to meet with the task force to discuss how things are looking and why those decisions were made, provide some background, what the resources look like and the budget and such. And this was the next meeting that we had when it comes to the task force. So I thought it'd be good to start here and then perhaps invite Darby Gilligan back to maybe to the broader task force. So, but that's kind of my thinking on that one. And Mike disappeared. I think he's got a 2-year-old, so I think he might be chasing her around the house. So Darby, you're more than welcome to go ahead.
Great, thank you so much, Councilmember Hamlin. That was such a great conversation. I feel very fortunate to have been invited to this meeting when Rep. Rule was in attendance, and I could just listen to her all morning. I love learning more about these connections, and it's been a big learning curve for me in the last 6 months, learning how all these things fit together. So I'm excited to share. If it's possible, Jill, I do have a very brief presentation. I'm happy to just riff and talk with you, but if I can share screen, I do have a few slides that I think may be helpful visuals.
Yes, I just promoted you to co-host. You should have screen share ability.
Okay, fantastic. Thank you. Great. So my name's Darby Gilligan. I'm a planner with the City of Bellingham. I work in our community development division, mostly on implementation of urban village plans, but it's also under the special projects heading. So I do end up having the opportunity to learn more about things like workforce, childcare workforce, and downtown safety. So I've been working on downtown safety issues for a while. And I just wanted to share, many of you were involved, kind of the last big push we had around downtown safe and welcoming topic was around 2014. And I'm not going to go through the details of this slide, but I do think it's encouraging and appropriate to look at all the great things that came out of that last push, such as well, MCOT we already had, sorry, but the launch of the HOT team, Grace and Lead Mental Health Court, getting a youth day center opened, and many other initiatives. But it was time for a refresh. So in 2021, in the summertime and even earlier during the pandemic, we started hearing from many downtown business owners and other constituents about a perception of increased issues downtown, lack of cleanliness. I think much of the problem was highlighted by the fact that we lost all of our downtown office workers. So we went from having a pretty robust, vibrant downtown to pretty quiet. Also, an obvious increase in homelessness that we're seeing from increase in housing prices and other issues. Questions about communication, who to call for what. We have a lot of resources in our community, but it's not always clear who to call and at what time of the day. And then obviously, I know you're all very well aware of the changes in the police services and ability to respond. So we were hearing a lot of questions and concerns from the community about those issues as they related to downtown. So what we started doing is just a basic services assessment, looking at what services do we have that overlap in the downtown community. Many of these are city or county-wide, but we started looking at what's the role of the homeless outreach team? How does Grace and Lead interact with our downtown population? Law enforcement, cleaning, landscaping, and beautification. And we identified had these focus groups and conversations with the people doing the work and asked them, how's your job going? What could we do to support you to do your work better? What do you need? What are you seeing out there? So it was a really wonderful opportunity to create some work groups, get people talking, get people introduced to each other. Some of these groups had never met. And how could we contribute to to supporting them in their work? So a lot of it was just starting with staffing issues. We expanded the homeless outreach team contract. We increased the cleaning and landscaping downtown and the number of street crew, and then launched private security, which I think it's really important. I don't know if you've had the chance to talk about this yet in this group, that the private security officers are unarmed, they are hands off, they are not intended to replace police services by any means. They are really intended to add more eyes on the street, to connect. And I've been delighted working with RSU. I had heard some good things about some work that they were doing downtown on behalf of private property owners, and have been very impressed with their approach of compassion and respect and relationship building being the way that they are successful in their jobs. So they are able to connect people to resources downtown, and provide some additional eyes on the street for cleaning, crime, and safety issues. They were a 24-hour patrol until the ambassador program started in this April. Safety ambassadors are something that we've talked about for downtown for a long time, but it had been diverted to other resources. And we now have a team of 4 that is patrolling between 8 a.m. and 5 p.m., 7 days a week. That is Tony, who is the lead, and Aiden on the right. And same thing, these are folks that are trained by an organization called Streets Plus, who the city has contracted with via the Downtown Bellingham Partnership. And they set up these types of programs and other downtown services throughout the country. And they are trained in de-escalation techniques. And we've been doing training throughout the last several months, introducing them to all the different service providers in downtown and throughout the city so that they are able to make those connections and links for folks. So I'll just finish my introduction of the programs and then we can get into some additional discussion. I've also been working very closely with Melora, and I'm so excited to see the county's new response team or response division, I guess, that she's heading up, and just talking more about how we can embed these downtown services within the framework of what's starting to take shape with ART and 988 and the outreach materials that they're able to provide, how it interrelates with dispatch so that we can make sure that we're dispatching the appropriate folks for the appropriate situations downtown. So that's been a wonderful relationship building. We've also recently launched a graffiti abatement program. I won't go into a ton of detail on that, but I'm happy to answer any questions that you have. It's modeled after a program that the police led, Bellingham Police Department, back in 2001. That's based on a very prompt response, clear protocols for reporting, and then prompt removal. So we have contracted with the Downtown Bellingham Partnership to also assist building owners to respond to graffiti issues. And then finally, the last program I wanted to highlight was a new city block program. This is also something that we're working in partnership with the Downtown Bellingham Partnership to divide downtown into smaller districts and really work on building leadership within those districts and the business community to provide training that they can take back to their neighbors, and then also so that they can collaborate and bring issues back up to the city so that we can have some coordinated training, promotion, outreach efforts, and coordination. So there's been a lot going on, as Dan mentioned, and understanding how these relate to a lot of the bigger picture issues in our community is so interesting and important. So I appreciate you having me here today.
Thank you so much for that presentation. So I'll do my best to look at hands. If I don't see one, please come off mute and just ask them. If you don't mind, I'll ask one. On the last program that you were just talking about, City Block program, you mentioned trainings, and it sounds like they would be targeted towards business owners. Could you tell us kind of what trainings those might be? And what would be the goal of those trainings?
Yeah. So we've started, the kickoff of that program happened at the end of March. And we're starting right now with just learning more about what are the key issues that business owners are facing. So some of the ideas that have come up are CPTED, crime prevention through environmental design. How can you design your storefront and your building to be inviting, welcoming, and also help deter criminal activity? That's one example. I mentioned the graffiti abatement program. So maybe procedures on how to respond to graffiti. We also have encouraged them to attend some de-escalation training, or how to deal with difficult situations in your business. We have the Ryan Dowd training coming up, which I'm sure most of you or all of you are very familiar with. As well as some other training provided by organizations like the Lighthouse Mission on how to approach people who may be in crisis or in need of help, to build confidence with the frontline staff, to be able to know how to address those types of situations, and then who to call if they feel like they need additional support. So those are some examples, but yeah, there's been a lot of different ideas generated by that group so far.
Great. And that sounds like that's going to be ongoing and a little bit of a two-way information flow. So thanks for that coverage. I do see a hand up with Brian Estes.
Yes, thank you for presenting to this group. Also on the call, I believe, is still Kim Souter of the local chapter of the National Alliance on Mental Illness. And we have some resources, materials, little cards that talk about how to deal with somebody in crisis. And so we wanted to make those resources available to downtown business owners. And Kim, are you still on the call? Could you just describe some of the services that NAMI provides or could provide?
Yeah, give me 1 second to get her.
And Brian, you're with NAMI as well?
I'm the president of the board of directors of NAMI.
Oh, great. Well, nice to meet you. Thank you.
Go ahead, Kim.
Sure. Thank you. Thanks. Yeah, we do a lot. Everything we do is free, Darby, or anyone on the call. I'm sorry. We have resources that you could offer. They could offer folks that they're meeting. We have ongoing groups every week for folks that are affected by mental health conditions or folks that support them. We also could do training taught by two individuals who have family members that live with mental illness. It's a 2-hour training. It just briefly goes through and describes numerous mental health conditions, communication skills, et cetera, et cetera. And I know we've done many things, outreach with law enforcement and schools, and people find that hearing from someone who has that lived experience can be very helpful, and then they can ask questions and we won't answer anything that we know, that we think we know the answer to. But yeah, so yeah, we are here, and we have people that are really impacted by mental health conditions in their lives, and they want to share what they know. And many of our programs are evidence-based programs also. We're not just making this up on the fly. So yeah, so I
That sounds
love to connect
fantastic.
with you, Darby. So
Thank you.
Thank
Yeah,
you.
I'll reach out to you. I barely touched on it, but as far as the communication improvements go, a big part of what we've been talking about are the external facing resources and the internal resources. So how do we make sure that the different groups, like the Downtown Partnership, the Mission, our park staff, what are they sharing? Is it current? How are they sharing it? And making sure we're coordinating across those different areas for the available resources. And then also internally, making sure that providers and staff are aware of who the resources are in the community. So I'd love to pull you into that thread, Kim, and talk about how we can share some of what NAMI offers. Those all sound like excellent resources.
Great, thank you for that, Darby. And I see Councilmember Hamel has his hand up.
No, Rep. Rule brought up that there's really no single solution to all of these issues. We all know that. I think it's pretty much you've all arrived at that conclusion. So Darby, I'm just wondering, you had mentioned I think Grace and Lead, and I'm wondering to what extent the Downtown Ambassador Program and RSU would be integrated with the alternate response team. And then would they also know about the resources of Grace and Lead, and like how does that interplay work, or if it does, I just don't know.
Yes, it does. Thanks for bringing that question up. So as part of these focus group discussions that we had when we were generating ideas, many of those have continued into regular conversational working groups. So I have regular meetings with our community paramedic, with Melora, with representatives from Northwest Youth Services. We kind of have the behavioral, mental health and homeless outreach services group that the ambassadors and the security staff are invited to. And it's a wonderful way to talk about how do we share referrals? If there's somebody that you're looking for, how can we help you? Like somebody who's in need, they're searching for on the street, how can we make sure and provide referrals or references or information about that? What are best practices? How are you responding? How do we make sure we're not stepping on each other's toes? They've been really wonderful conversations, and those will continue. We also have been talking quite a bit about the dispatch aspect. So both the ambassadors and the security leads, we have another team that's made up of someone from dispatch, someone from BPD, the library security officers, the parking garage attendants, and talking about, okay, how can the ambassadors be called in? So they actually are connected with dispatch right now, not through necessarily the 911 system, but dispatch is aware that if there's a situation that's not an imminent criminal health safety issue, but that could benefit from having a presence or someone responding, they're able to call private security in the evenings or ambassador during the day to deploy them. So, and then we have been, again, continuing to think about all these different pieces of the puzzle. And as the alternative response team is developing, how can we make sure that dispatch of these district specific services is included kind of down the hierarchy or the web of resources in situations where they're the first ones on the scene. How can they report up? And then also if it's a call into 911, how can they deploy them in appropriate situations? So it's ongoing and it's starting to take shape, but I feel like in the last few months, especially with the progress that the alternative response team has been making, that it's starting to come together. And I appreciate what you said too, Councilmember Hamel, about how complex these issues are, and it becomes so overwhelming. And some of the conversations we have with, with the community about, oh, these are just big unsolvable issues, but we've really been focusing on what can we do in our sphere, right? And it's just encouraging to hear Rep. Rule talking about that too. What are we able to affect positively and have some positive change? And I've been hearing, I'd love to hear if any of you have heard any comments or experiences that people have had with our ambassador or security staff. I've been hearing positive things, not only from our behavioral and social services folks, but also from the business community about feeling more supported all around. So yeah, work in progress.
Darby, thank you so much for that answer. I didn't see a hand up. Oh, I do see Stevens, and Stephen, permit me, I'm going to go ahead and just ask a question real quick. Darby, one of the things in your presentation I like is you really called out, hey, we've heard some of these issues before. Here's what those issues were at the time, and here's what we did to address them. I think that's really important for people to see. One, that those issues weren't ignored, but other things have happened since. And my comment / question is going to go along that line even a little bit further. So other interventions that were looked at is, obviously, if you're going to have people, if you're going to move somebody along from a position on the street in front of a business, they need somewhere to go to. And there's been lots of terms about the diversion to, where do we send people to? And some, and I don't think it was a community solutions work group, but it might have been another group, but I think Mayor Linville at the time convened, which looked at, one of the things that we don't have is we don't have an organized camp place. Now, we do have tiny home communities. We didn't have those back then. So we have more assets than we did. There's a couple of interventions that were recommended that can be kind of low cost. And I believe for want of an operator is what the community was told. And those are like safe parking and safe camping. So one of the things that I think about from moving somebody on, and many of the folks have behavioral health challenges, and so moving is very difficult. Moving can actually be traumatic. It'd be a lot better though if we could move them to somewhere. The mission's now full, right? Even at this time in the year, I'm hearing that the mission is full. So we run into this problem again, and that particular intervention wasn't acted on, and maybe wasn't able to be acted on. Could you just comment on the divert to where, and what are there any more things afoot? Because what I would love to see as a social worker is when RSU comes along, and I have heard good things, by the way, when they're moved, there's somebody they can go and they don't have to move the next day. And I think that's one of the things that's happening, is we are seeing that repeated moving and moving and moving. And folks that study that, that's traumatic. That is their home for the day, even if it's a piece of concrete in front of a store, that was their home for the day. Could you speak to that ever so bit? And then I would like to get to Stephen Gockley and then Councilmember Ham.
Yeah, great. Thank you, Mike. Well, one thing I want to clarify is that the contracts that the city has with both RSU and with the ambassadors are only for public property. So it's, situations on public facilities, the library, all of our downtown institutional buildings, and then sidewalks. They aren't moving people out of anywhere in doorways and private property of any sort. So that has been something that's been a question from multiple folks, and I think is important to clarify. My understanding is that there has been space available at base camp. I know that there's been some times that they have maxed out over the winter, but generally there's been around 30 spaces. And the approach that the security and ambassadors use is really a request for people to move. They're not forcing anyone to leave. They're not touching them or harassing or bullying in any way. In fact, I guess there's been some really great relationships built. So it ends up being a request, and sometimes people refuse that request and they stay, and that's okay. So as far as the bigger picture of just shelter expansions and things like that. That is not my primary focus, so I can't speak to everything. The city is, however, working very closely with Lighthouse Mission on their expansion plans to move back into Old Town and expand into a larger shelter. I have not heard anything else about the safe parking type model. Possibly, I think Councilmember Hamel would probably be more in the loop on that than I.
Great, thank you for that. Next to Stephen Gockley and then to Councilmember Hamel.
Darby, thank you for the presentation and for joining us on such short notice from Councilmember Hamel's invitation. I appreciate the thinking going on in the city that's developing some of these services. And it's clear from what you've said to me so far that you're trying to find a niche for both the security patrols and the safety ambassadors. I'm still trying to understand exactly what that niche might look like. You mentioned dispatch is trying to establish some hierarchy for when they might communicate with any of these folks. Can you give me some examples of, I get that you're limited to public property. I get that mostly it's a request to move on without much capacity to follow up. I'm trying to understand what the scope is of what both the security folks and the ambassadors might take, and what situations would they be most appropriate for, and what might be passed on to other resources.
Yeah, that's a great question. So I would be happy to send the scopes of work for both organizations out if anyone wants to see it in more detail and like get into the weeds. Generally here, one example is we have monitoring of the parking garage that's done remotely. And in the past, before these services were established, if the monitors couldn't have someone respond, then it would go to 911 and it would deploy a police officer to the parking garage to respond. In many cases, it would be people, hanging out, kind of loitering, smoking, riding skateboards, whatever sort of not generally malicious activity. So those are situations where dispatch has been able to call the ambassadors or call the security officers and ask them to come and be a presence to introduce themselves to the folks and say, this isn't really a place that's appropriate to be partying and hanging out. So that is saving on our police resources for something like that. That's probably the most common example of what's happening. I don't necessarily have a vision in my head of a situation where someone would call 911 that would then not, if it didn't warrant police response, that they'd send out an ambassador. I think most of the time it's coming from the ambassadors up. In a situation where somebody is maybe non-responsive, they'll go and they'll talk to people and they'll kind of, say, hey, are you doing okay? And in a situation where they're not getting a response or someone appears to be having a medical issue, then they're calling 911 and requesting emergency response for that type of situation. Yeah, I don't know. We could probably all come up with some examples of things that maybe that 911 could say, hey, if you're in town, can you, or if you're around the area, can you go by and maybe just talk to this person if they're having a mental health episode. If it's somebody that the ambassadors know in particular, that they could maybe help de-escalate, they'll offer people a energy bar or hand warmers or a cigarette and like, hey, why don't we go for a walk and talk about what's going on? So I don't know if they would be the primary, but hopefully they could be a support team for the behavioral health and police folks that are dispatched.
That's helpful information, and thank you. I appreciate that. I for one would take you up on your offer to circulate the scope of work documents. If you could send those to Jill Nixon,
Sure,
she could distribute them to the committee or to anybody who wanted them.
happy to do that. Yeah.
Thank you.
All right, Councilmember Hamel has his hand up.
I just want to respond to a few points here and add some information into the mix. So last night there were 182 people that stayed at the mission. The night before was 175. The night before that was 181. So if you can, all this is public information. Go to Lighthouse Mission, I think it's .org, and you can see there's a graph that shows the last, I think, month or so. And we did hit some high days. We did hit 200, but we're not at that now. It is concerning that it's May and we hit the higher numbers in late April. So, and like Rep. Rule said, all these things take time. They're not going to happen overnight. The new mission facility is in the fundraising and permit process that will go back to Old Town. It'll be a larger facility, so it can handle more capacity there. Mike, to your point about safe camping, safe parking, the city council has approved that years ago. We're set. We need an operator. We don't have a qualified operator, and the problem is that it goes back to like the workforce issue. We have to have people to do it. If we don't have people that can actually perform the services, then we don't have the program. And so that never materialized. As you can imagine, people aren't lining up to run a safe parking or a safe camping facility. And it would have to be safe. We can't have people using drugs, and we know that fentanyl and meth now are very prominent on the streets. And so we can't have that happening within a safe camping or safe parking zone, because I think it would put the inhabitants at risk, especially the ones that aren't using or the ones that are in recovery. So I think it's important to have that standard. I think those are the things I wanted to just touch on real quick.
I appreciate that. Yeah, no, I know that there's inherent challenges that, and it does make one wonder. And I don't know exactly when Councilmember Hamel, the council took action on that. I'm wondering if at some point there's possibility of a different response, or maybe we cast a further net, or would the city ever entertain doing some of those things directly and adding in as to part of its public works or things of that nature. So, I hear you that people are knocking on the door to say, hey, City of Bellingham, I'd like to run this program for you. But I just see them as like part, especially for folks that are still in the pipeline waiting for housing. We know that's clogged. We know that that's not moving very well. We know that's part of the problem. If more people were moving through our system and from streets to housing, it would be less of an issue. So we're really talking about kind of in the intermediate time. But do you envision, or could you envision, or what might that look like if we don't have responses on that RFQ or RFP? I forgot what the process looked like. Might there be another step that we could take as a community? And what are your thoughts on that?
You're asking me?
Yeah, or Darby, either one, because Darby represents planning, and I really appreciate that lens too.
I'll take a shot at it. So for the first several years when I was in office, I didn't think that the city should be an operator on any of these things. I always thought it should be the county, since they had a health department, they have qualified clinicians, they have a county doctor, an MD. We don't have any of those things. I've looked all over City Hall. I can't find anyone that fits those qualifications. We have great planners, we have great parks people, but cities are pipes, lights, parks and roads, and some services. But I don't know if should we change that? I don't know. My views have evolved quite a bit. I'm not opposed to it. We're looking at doing an immigration resource center, perhaps at the city level, perhaps at the county level. A few years ago, I don't know that we would have entertained that idea. We would have said probably, we'll go to the Opportunity Council or go to Northwest Justice Project, or whatever law advocates. Well, maybe we need to have that. And I'm a believer that we need to have the Immigration Resource Center as it relates to providing services for people experiencing homelessness. My perspective has not changed on that. My perspective is that we need to provide as much housing as possible. That is the solution, and services for those who need it. But that the solution of a shelter is a near-term solution. It's a temporary solution, and it doesn't it doesn't fix the long-term problems that people have. When people access services at base camp, that can help for sure. But unless we have a place to go, like you said, Mike, divert to where? We have to have a place for people to go. That's why I was one of the 3 people that started the Home Fund in 2012 and instigated the $1590 last year. That puts us at 7 million just with those funds, and then we're at 10 with ARPA and the other funds. So we are making significant investments in housing, but it's a slow process, and we all know that housing costs money. We live in a very tight market. Land is not cheap. We have a finite supply of it. So it's kind of a long way of answering your questions. Should the city become an operator in some of these things? Maybe. I think that we'd have to staff up for it. We'd have to bring in experts. It would be a shift in kind of municipal thinking, which I'm not opposed to, but it's not where we're at right now necessarily.
Thank you for that response. I wasn't even sure I'd get a response. It was almost a hypothetical, but I really appreciate the response. I also wanted Darby just mention in my brief interaction with the RSU people, they were quite kind. I must admit, being a little surprised. I'm a licensed clinical social worker. I care a lot about behavioral health. I didn't imagine a private security firm would handle that as deftly as they did. So I only saw one thing. It was in front of Unity Care. And I just appreciate that a program like this that was done. I think quite often these things end up looking like just kind of whack-a-mole and just move the person along, and they're quite caustic and they further trauma. So I appreciate that there has been care, and even in your presentation and the way you state their roles and what they do and how they operate with people, you had a lot of care wrapped in that. And this subcommittee, obviously, we care a lot about that. We want to see people moved on and into the right places, but we want to stop the cycle of trauma. So really appreciate that. Before I go on though, I didn't see any other hands. Do we have any other questions about kind of some of the efforts going on here in downtown Bellingham for Darby? Right. I am not seeing any. We want to thank you so much for your time and for taking questions and for addressing issues. Thank you in advance for responding to the scope of work. I think that would be useful for our groups to see. And Councilmember Hand, thank you for bringing this to our attention. I think this is a real granular issue, and it could be very divisive. So it's great to get the information kind of firsthand for our committee members today.
Thank you so much for having me, and I appreciate all the work that you all do for our community.
All right. Well, we've had a couple of rousing presentations. We only have a few minutes left. I believe our next thing on the agenda, we don't have TJ Morris from Northwest Youth Services, but we have a few minutes left before we break to solicit agenda items for the next joint meeting with Legal and Justice. Jill, please.
Thank you. I've got a few items on the agenda just to let you know. One is mental health sentencing alternative. Eric Ritchie and Maya Vanyo are going to talk about that statute in the RCW, and an update from Perry and hopefully Doug on the Whatcom County's alternative response program. And then mentioned at the last joint meeting was possibly a presentation from NAMI's Clubhouse International model. And maybe Brian, if you're still here, you can mention that.
Brian, you have your hand up. Would you like to go ahead and
yeah, Ruth Davis, who is the sort of chair of this advisory group that is in the process of creating this clubhouse, can be available and talk to this group briefly about the goals of the clubhouse, how it kind of fits into mental health recovery in the community. If that would be, I think it would be interesting to have maybe like a 20-minute segment on that if we feel like we have time.
Brian, we always work out all of those agenda topics with our other committee. I'm gonna call out and say that sounds like a really important one, and I think you might be hitting, if not squarely on the head, but at least close to things that Arlene Feld and some other members have brought up, which are, we need a place for people to go before it's a crisis. And we need a place where there's not a strict referral criteria. And if I'm not mistaken, your clubhouse kind of aims to be a resource for folks that maybe struggle with mental illness and need a place to be and may need resources or may just need a safe spot to be out of the rain.
No.
So
No.
please, Kim,
Okay,
go ahead.
Go ahead, Kim.
It is a place, the International Clubhouse has very strict standards, and they do require referrals from members. It is not like the Rainbow Center that might have been called a clubhouse, I think, that was previously in Bellingham. It is a very specific model, and Ruth could definitely speak much more clearly than I can, but I know there is a referral. It is not a drop-in center. It is a place where folks that are there have a work order day, and it is a place for people to regain skills that they may have lost as they've been affected by their mental health condition, and help them get back into recovery. That's my short synopsis of that. Thank you.
Great, thank you for weighing in on that. So Jill, I would like to go ahead and put that forth. We'll talk that over with Legal and Justice, but that sounds like a great thing to have on our agenda.
Thank you. Is there anything else you'd like to include on the agenda?
Looking around at any of our other members. Heather Faraday, yes, please.
My apologies for being late. I had a conflict and I look forward to listening to the recording. One thing that I have been thinking a lot about is the Vera report that was published in 2017, I think. I'm looking, if you Google Vera report Whatcom County, you can find that. And they have some great recommendations in there about reducing the jail population. And I know we invested a lot in that report. They had some very specific ideas around programs that could be helpful. Things like sobering centers, different kinds of case management to reduce the length of stay for jail days. I think it would be worthwhile to do a status update on those recommendations. And have we actually done anything based on those recommendations? What are the opportunities now? I'm not sure that report has seen a lot of light of day, and I think it's worth bringing it back to say, are these still relevant? And I think our committee has a role to play, or could have a role to play in that, particularly they do have diversion on there as a recommendation. So it's pretty relevant.
That's an excellent point. Stephen, since I see you're still with us on the call, I think Heather's point is broader than just a joint meeting. I'm wondering if it's something that might be tackled by steering, if you think that might be an appropriate place, because that really could be part of the direction setting. I know we've already kind of established to some degree an agenda for the year for the task force, but what Heather's bringing up could be a really good way to kind of cross-check against that. I just wanted to get your take on the best venue. Might that go to steering to talk about, to strategize, or straight to the combined meeting? Do you have any thoughts on that? I'm sorry, I'm putting you on the sport.
No, that's okay. I mean, first of all, Heather has gently but repeatedly reminded us of that report's recommendations over time, and I thank her for her persistence in continuing that. I think steering would be a good place to start that conversation, and I certainly would lend my support to us not continuing to drop the ball on that. There are ideas embedded in that we should at least talk about and figure out what response, if any, we're ready to make on those. So I would agree, Mike, with your suggestion that maybe steering committee is the place to start talking about that, but direct it somewhere. And I think ultimately one of the joint meetings between legal and justice systems and behavioral health would be a good landing spot for some detailed work on that.
As I think about what she said, and kind of what Darby did too, like look at your reports, what did you do? And putting it side by side, I think is helpful. It could also identify gaps. I also think about that with our racial toolkit, and just so the committee members know, there are or groups of us that are looking, how do we operationalize that? We actually want to create kind of a tracking form. And part of the reason that we want to do that is we want to be able to have something that might really show that work, that is kind of transparently showing that work. It also acts as a tool to help us conduct that important work. But it's like, you know, you may have these goals, you want to see that progress against it. With that, I'll stop. Brian, really quick to you, and then we'll need to go to public comment. We're about 10:30.
Yeah, I just wanted to second Heather's concern, and I think, Stephen, that's a great idea to the steering committee. But I just wanted to underscore, Heather mentioned updating Vera, because things, you know, there are some things that may have changed since they first produced that report. So that's an excellent suggestion, and I endorse it wholeheartedly.
All right, Jill, hopefully we captured all that. Is there anything else before we break and then solicit public comment? Anything good of the order? Jill, do we have anybody who'd like to speak for public comment?
Yes, we have 2 attendees. If either of you would like to speak to the committee, please virtually raise your hand now. No hands are raised.
All right, if you do think of additional agenda topics that you might like to see at our upcoming joint meeting, please don't hesitate to reach out to myself or Councilmember Hamble. We'll make sure to lift those up. I want to thank everybody for a great meeting today. Thanks to our presenters, and hope you all stay well until the next time we meet. We're adjourned.